Welcome to the AUA News Inside Tract podcast, an official podcast of the American Urological Association. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.
Welcome to AUA News Inside Tract. I'm Dr. Sutchin Patel, the Curator of Explorations, Urology and Extreme Environments, the History Exhibit at the 2026 AUA meeting in Washington, D.C. this May. Today, we'll take you behind the scenes of how the exhibit came together, the stories that inspired it, and how extreme environments are shaping the future of urology. I've often been asked, how does one create an exhibit? How do you go behind the curatorial process, and what goes into actually making an AUA exhibit? So I've been involved with the Dittich Museum since 2011, and the process of creating an exhibit has changed and evolved over time. Explorations is a very broad topic, and so we start with a large brainstorming session. The guest curator, in this case myself, Tupper Stevens, the AUA historian John Phillips, the past historian Ronald Rubinowitz, a few members of the AUA History Committee, as well as the design team all get together, and we really work the topic. And so we take explorations and pare it down, and our exhibit this year primarily is on space exploration, though we will also cover explorations in other extreme environments, such as the jungle, the desert, mountains, the Arctic, Antarctic, and the depths of the ocean. After focusing on these side topics, we then break down the exhibit further into subtopics. So for instance, the space exploration portion of the exhibit will be broken up into Dr. Abe Cockett, who was a chair at the University of Rochester, as well as a former AUA president. And he was one of the first to determine that space flight and space exploration would have significant urological implications. Dr. Jeffrey Jones, who will be giving an ethics talk at the History Forum this year, contributed a number of panels on urolithiasis risk in space, as well as urinary retention in space. We have Dr. Chris Peniston speaking on space nutrition. We have Sarah Best and Kim Soliak talking about the disposal of wastes and the space toilet, as well as Dr. Samuel Samra talking about space spinoffs. And finally, one of the topics that's very exciting, both in urology as well as in space exploration, is the use of burst wave lithotripsy for the treatment of stones, both here on Earth as well as possibly at the International Space Station. Once we fit these topics with each of these contributors, they do a significant amount of research and work writing the panels as well as writing chapters. And in the end, the finished product is not just the AUA History Exhibit, but also a textbook that goes into depth into each of these topics.
Good afternoon. My understanding is Dr. Sutchin Patel had some questions that he asked me to address regarding this year's upcoming History of Urology exhibit. And I'm very happy to try and answer those questions the best I can. I'm Dr. Jeff Jones. I'm currently a professor of urology and the Center for Space Medicine at the Baylor College of Medicine. And I happen to have had a career at NASA and in the military as a flight surgeon. And his question was, how did I get involved in space medicine? And I'll have to say that from my perspective, this came honestly through my father. I'm somewhat of a legacy. My dad was involved with NASA since the very beginning in 1962. Our family moved from his assignment at Langley Air Force Base in Virginia to Houston. Even before they had built the manned spacecraft center, what it was called before it became Johnson Spacecraft Center. And his involvement included Mercury, Gemini, Apollo, Skylab, and then Shuttle. And he retired from NASA as the unit for the systems innovation and for the Shuttle program. So I had an opportunity to grow up with the space program with many of the personnel, astronauts, and flight control personnel that were involved with with supporting space flight operations. And so it was in my blood. And I went off to medical school and training in urology at Indiana and did my fellowship in urologic oncology, and then was back at Texas Tech, University Health Sciences Center as the division chief in urology. Uh, when um, I got a call from an old colleague, Dr. David Short. I had graduated early from medical school and worked for Dr. George Noon and the other DeBakey associates in a cardiovascular surgery research before I started my internship in general surgery. And he had been tasked with the new life sciences program director position because they'd had some issues with the prior director, and they were still having the same issues they were concerned about, which was kidney stones. And so he talked to me about that, and I'd had a prior history as a military flight surgeon working with the Navy principally, but supporting the Marine Corps aviation and the U.S. Air Force and Air National Guard aviation for a number of years. And so he said, would you like to work with us? And that turned out they had a program jointly with University of Texas Medical Branch to do a fellowship in aerospace medicine, which I did. And I became a NASA flight surgeon. And then I supported many space flight missions with the shuttle program and with the International Space Station. I had an opportunity to lead the International Space Station uh, medical operations for a number of years as the lead flight surgeon, and then became interested in exploration when the Constellation program began, and had an opportunity to lead exploration medical operations as well, developing requirements for lunar missions, return to the moon, and Mars missions. So that's kind of my background and how I got involved. It was definitely one of the most, I would say, challenging and fun jobs at the same time. Most fun you can you can have as a flight surgeon, according to Dr. Pat McGinnis. I agree with him on that. Um, and there were some outstanding people I had an opportunity to work with. And since then, I've still kind of maintained that role as the urologic consultant for NASA in a number of different issues. And we continue to work on issues even today. Then Dr. Patel asked me to talk about some of the challenges that are urologic in nature that are associated with space flight. And I've had an opportunity to talk about some of these things at various urologic forum, like the South Central Section meeting and even at the AUA Board of Directors meeting. And just to kind of summarize a few of the issues that we face, that one, maybe not surprising, but some may be surprised by, is the potential for kidney stones. And there's been one kidney stone in flight during the Russian space station Salyut program prior to the Mir. And then there's been at least 15 kidney stones in astronauts after space flight, even though this is a population that's been selected not to have kidney stones. So these are environmentally induced stones. And why would astronauts develop kidney stones? Well, when you're in this microgravity environment, somewhat weightless, you don't have the stresses on your bone. You tend to leach mineral from the bone into the urine, both calcium and phosphorus, and that makes it more likely that you are, because of the increased saturation to urine with calcium, to form kidney stones. And that is a significant risk because it can have a major impact on a mission should it happen in the course of a flight, especially a long duration flight or a flight, exploration mission to the moon and Mars. So yeah, it's a key issue. I mean, we've had challenges with waste management, so to speak, on space missions for quite a while. And especially I'd say during the early capsule flights, Mercury Gemini, Apollo didn't really have a waste management system to manage both urinary or fecal waste. But that changed with shuttle. We had a waste collection device that was specifically designed to do that, and we become more sophisticated over time to develop ways to separate the phases and to even recycle the urine, which is a key thing for any kind of long-term mission. Water is a precious commodity, and so you want to be able to recycle things like oxygen and water if you're able to, so it's less you have to carry with you. And so we are using a recycling device on the International Space Station now, and moving even better and more robust life support systems that reutilize oxygen and water, et cetera, for exploration missions. The other major issue that we have with urology currently has to do with the potential to have urinary retention. And seems to be multifactorial. There's obviously lack of gravity gradient that we normally have on Earth when you're in orbit around the planet or you're in interplanetary space. And so without that gravity gradient, there is some disturbance in the micturition, the voting response. However, we often see a condition that's called space adaptation syndrome. Some call it space motion sickness, where there's a transition from the gravitational environment of Earth to the microgravity environment of space flight. And during that time, there's a number of things that go on that affect the neurovestibular system, and potentially some fluid shifting from the feet up towards the brain that can cause fullness in the head and changes in vision, things of this nature. And during that time, it's not uncommon for astronauts to feel sick to their stomach, and they may even vomit. And to counteract that, we use anticholinergic medication like Phenergan. Can be given intramuscularly, or it can be given through suppository. And that medication seems to relieve this nausea to a significant degree, but it has the effect of inhibiting the detrusor contraction. And so that seems to be a factor in the astronauts developing urinary retention as well. And then there's a third factor that might be at play. That is the fit of the spacesuits that they wear. They have to wear spacesuits for launch and then launch and entry suits, and they have to wear spacesuits to go outside the vehicle while they're in orbit, what we call an EMU, an extravehicular mobility unit. So a spacewalk suit. And these suits have a liquid cooling garment that they wear inside to keep themselves cool during the sunlight exposure while they're in space. And those suits can have some fit issues because the astronauts' spine actually elongates while they're in orbit. Because of the lack of gravity vector, they get some spinal elongation. And so the suit fit may be tight in the crotch, and that can cause some compression of the perineum and increase the outlet resistance. And so that seems to play a factor. There's still a question of whether or not there's a potential for a neurological type of effect from the space motion sickness that could affect the micturition reflex. And we still haven't studied that well enough to know if that's also a fourth factor. But that's characterizing the nature of the problem that the GU system faces for spaceflight. Then the question that Dr. Patel asked about history and what role history plays when we're talking about future missions. I think that history is very important for us to understand because it may unlock clues about not only what the challenges we'll face on future missions, but how best to approach them and how best to overcome these challenges. And so I think a student of history, one that understands history and understands these things, can be better prepared for the future. And the future, we hope, is exploring the solar system to the moon, back to the moon, and then on to Mars and other destinations. So yes, we need to understand our history well, and that I think that we exhibit that highlights the history and neurology of extreme environments is important for that in that respect. Last question that Dr. Patel had for me related to the upcoming history forum at the AUA annual meeting in Washington, D.C. And he wanted me to talk a little bit about my planned discussion at that forum. And that has to do with what are the ethical dilemmas of space flight that clinicians face and that astronauts face. And I think there are several. There are risks of space flight associated with the vehicle, whether it's the propulsion system, electrical system, the guidance and navigation system, the life support system. And we have to inform our crew about those risks, and they have to accept those risks. And that is something inherent to space flight. It's still a dangerous occupation. There are also medical risks, medical specific risk, and there are acute risk and long-term risk. And there's all the acute things that can happen that are normal just living even terrestrially, not only in spaceflight, but terrestrially. And things like kidney stones and appendicitis and vein thrombosis are things that can happen. But there's some unique risks that are peculiar to astronauts. One is called SANS, this spaceflight associated neuroocular syndrome, which seems to be related to microgravity and possibly a shift of the pulmonary system upwards in the chest during microgravity that might be compressing the superior vena cava or some other factor that's not allowing normal drainage. And you get increased pressure, intracranial pressure, and you get some disturbances of vision with changes observable in the retina. It's a fairly complex issue. We don't fully understand it, but that is something that's unique to the space flight as a risk to the astronauts. Not all have it. It seems to be body habitus related in some ways. The other one that would be unique, in addition to all the environmental risk, like space vacuum, having decompression type illness and things of that nature, and failures of the propulsion system, leaks of toxic gases, etc. But also there's this radiation issue where the crews are exposed to radiation that's trapped around the Earth, what we call and trapped in the geomagnetosphere of our planet. And so you have to traverse that, or you'd have to experience passage through the South Atlantic anomaly where the geomagnetosphere dips down lower and the Van Allen belts dip down lower. And that particular risk it is known and we've somewhat understood it. But there's on top of that, there's the potential that the astronauts could be exposed to solar particle events or solar proton events, especially big ejections of the coronal mass ejections that could provide a significant exposure of the crew to not only things like X-rays and gamma rays, but to high energy particles coming from the sun. And so that's an added risk. And then there's this kind of ubiquitous galactic cosmic radiation that is sourced from things like supernova and quasars and potentially even black holes that spew out atoms at near relativistic speeds, so close to the speed of light. So they're high energy and they can cause significant damage to cellular structures, including the DNA. And so that can put the astronauts at both an acute risk if it's during a coronal mass ejection or a long-term risk from chronic exposure over time that could lead to things like neurodegenerative disease if it hits the brain, or to the potential to cause cancer from mutations that might result from the effects of the radiation, ionizing radiation on the nucleic acids. So these are risks that crew face. This is, the ethical concern is that the astronauts really understand these risks, and are these risks that are acceptable from a society for the astronauts to go through. And I think that we have to make sure they're well informed, understand these risks, and can articulate that they understand and accept them, and that we in the spaceflight community try to mitigate these risks as best we can if we're going to send astronauts into these environments. So that's kind of the thrust of my discussion. Um, but there's other things too, like how do we do medical care? What kind of assets can we take? Because we can't take a hospital with us. We can't take a full up medical capability, but we have to have enough medical capability to respond to the spaceflight emergencies that may occur. And so balancing, things like volume, mass, um, power constraints that such equipment would require with other priorities that the vehicle needs in order to successfully conduct a space mission. That's an ethical challenge for us. The capability that the crew has in terms of uh, the physician, paramedic, some medically trained person that can serve as a crew medical officer. That's been part of um, our spaceflight paradigm for a long time. But what's the right credentials and what kind of training does the crew member need? And we have to realize that the crew has other duties too. So that won't be the only duty that the crew medical officer has. And then what happens if the crew medical officer is the one that's affected by an emergency medical condition? Who's going to take care of them? So these are other sorts of challenges. And then there's always the big challenge of what happens if there's a crew member that would expire during the flight, and how best to manage that. So these are some of the ethical dilemmas that we face when it comes to long duration and especially exploration class space flight. And that's what I'll be talking about at the upcoming History Forum in Washington, D.C. But thank you very much for the time to talk about these things, and I very much look forward to seeing everyone at the meeting, and to maybe answering some questions you may have.
A really important part of every exhibit is a central artifact. And so this year's central artifact will be a replica of the Apollo spacesuit. The spacesuit essentially epitomizes mankind's ability to adapt to the most inhospitable environment, space. And so we hope to have that spacesuit available for viewing, as well as the story behind how it was created and how it works. Another key aspect of the exhibit are our speakers. We'll have Dr. Jeffrey Jones giving the ethics talk on the medical ethics in space exploration. And we're also lucky to have our Bicknell lecturer, Dr. Jay Buckey, who is a U.S. physician and astronaut. He flew on the STS-90 space shuttle mission titled Neurolab, and he'll be discussing his experience as an astronaut, as well as how that translated over to his current clinical research. Finally, I'd be remiss if I didn't mention the fantastic graphics team that we have that helps us design the exhibit every year. So definitely kudos to Hannah Konetsky, who I know has done a wonderful job on the upcoming exhibit. So we're really looking forward to see that as the final finished product. So you can see creating an exhibit is really a very massive undertaking and a team effort from all the contributors to the panels and the chapters, to our speakers, as well as our fantastic design team. I've also been asked in the past, why is it important for our field to think not only about its history, but also where urology might be going including beyond Earth. So we live in exciting times. We're in the era and the beginning of commercial spaceflight, and we have the upcoming Artemis mission coming in March. I think history teaches us lessons from our past so that we don't make the same mistakes in the future, but it also makes it so that we are not constantly reinventing the wheel. Historians love to quote George Santayana, those who do not remember the past are condemned to repeat it. But our past also allows us to get a glimpse a bit more into the future. This is primarily because we're all standing on the shoulders of giants. Overall, history allows us to adapt to changes, and it is this adaptation that allows humans, and for the purposes of our exhibit, the medical field, to move forward and tackle new challenges as we progress. If you want to learn more about what to expect at AUA 2026, please go to auanet.org/AUA 2026.
This has been an AUAnews Inside Tract podcast. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.